Guys, welcome back to San Antonio Living. Well, you know, summer means shorts and skirts and maybe have some embarrassing varicose veins or even spider veins. Well, why wait any longer to get rid of them? And they can be gone in just one afternoon. Here's more.
We're here in our new office. We have an expanded facility, and we'd just like people to have an opportunity to see it and come on and meet us. We've been actually doing veins before the age of laser as an outpatient, and after a while we realized that we either had to commit to it or get out of the business because we wanted to do it absolutely right. We decided to let other people know about this concept, and so we have affiliated clinics now in Dallas and Fort Worth, and 3 in Mexico and 1 in Chile. So we're actually in a small international group of dedicated people. Probably spider veins are the most common thing that we see, and the thing that bothers people the most. It's estimated that as much as 1/3 of the population of our country that are adults may have some element of spider veins. So it's a very common disease. It's generally not something that's going to injure anybody, but it just looks terrible. So people are very concerned about it. You can take care of spider veins in many ways. We feel that the best way is to treat it with injections because it's faster, cheaper, and most reliable. The key is to make sure you take care of the whole problem. And many people just inject the spider veins, and if there are underlying problems, they neglect them or don't realize that they're there. And so to get a good job, you have to really do it properly.
This patient is very nice to come with us today. She's had all the procedures that we offer at the clinic. The first procedure was done on her leg here, where it's called laser ablation of the Saphenous vein, which is the large vein that feeds the varicosities. She was having a lot of pain with those varicosities, which is the first symptom. She didn't want it to go into the further complications, which are blood clots and bleeding and skin ulcers, and so we treated that vein with what's called laser ablation, where we insert a laser into the vein and actually weld it shut so the blood can't fill the large branches in the leg anymore. And that's done in a local anesthetic here in the office. It takes about an hour, and you can go home and go back to work if you want. The second procedure she had was called Phlebectomy, where we actually remove the remaining branches that are being fed by that large vein. Those are the true big varicosities that most people relate to when they see their parents had them or their grandparents had them. And those used to be treated with stripping. So now we don't do any strippings anymore. It's all done with either laser or phlebectomy. That's most people's reason for not coming is they had these horror stories that my grandmother was in the hospital for a week and there was a lot of pain and she missed work. All that is gone now with these new procedures. And then today what we did was spider vein sclerotherapy, which is the last of the smaller veins, more for cosmetic reasons. These were injected with a chemical that makes the vein scar on the inside and decreases the visibility of those spider veins. Most of the patients, the day they come in here, we can kind of tell them all that they will need done and how long it will take to do it. All the procedures are done here in the office, local anesthesia, no hospitalizations. They take about 30 minutes to an hour each time. All the procedures are designed to keep you up, walking around, back to work, back to children, whatever you like to do during the day. Exercise is fine. All those things can be continued the day or the next day. The big things that cause varicose veins is gravity. So anything that will increase the pressure going down into your legs will make the veins dilate. And then you put that on top of a little bit of heredity. That's the big issue. If your parents had them, you've got a pretty good chance of having them. So crossing your legs, not necessarily, but standing without moving your calf muscles or thigh muscles is the big issue. And prevention-wise, my first step is put those people in compression stockings. It's a hard sell in South Texas with the heat, but they really will prevent a lot of that expansion of the veins when you're standing and makes your legs feel better during the end of the day.
The reason why you should come to Veintec is because we offer the best service in the most completely equipped surroundings. We have the most experience and the most expertise. And if you want to know what your trouble is, you want to know how to fix it, you want to have confidence in your doctor, and you don't want to take any chances, Veintec is the place to come.